We all here and ready to start?
There's blood in the water. I mean, you gotta understand where we're gonna go, okay, right? Where it comes from.
Thank you for being with the Senate Finance Committee. Today is Wednesday, March 13th, and we are going to begin our voting session, and it's going to begin with Patrick on Senate Bill 684.
Senate Bill 684 alters and extends reporting requirements on health insurance carriers relating to compliance with the federal Mental Health and Addiction Equity Act, the Parity Act. Under the bill, a carrier must submit a report as amended every 2 years that includes, under the amendments that are being offered by the sponsor, Senator Augustine, they'd have to submit a report every 2 years that includes, among other things, information on non-quantitative treatment limitations required under the Parity Act and results from a comparative analysis conducted by the carrier. NQTLs are processes, strategies, evidentiary standards, or other criteria that limit the scope or duration of benefits for services provided under a health plan. And then the bill also gives the commissioner additional enforcement tools to hold carriers accountable. So these amendments that are reflected in the reprint, it's a very technical bill with a lot of detailed reporting requirements. These are amendments that have been approved by the House and that Senator Augustine is fine with as the Senate sponsor. And generally speaking, the Insurance Administration and some of the proponents have been working on these throughout session, and so some of the highlighted changes in the amendments. They would establish requirements relating to the comparative analyses performed by the carriers, require submission of the reports every 2 years instead of annually, and require that reports be submitted on each product offered by the carrier in the individual small and large group markets. And then the report must include the results of a comparative analysis on not less than 5 of these NQTLs that are selected by the insurance commissioner. These amendments also alter requirements on carriers when performing analyses, require the commissioner to take certain actions relating to the submission of data by carriers, and they expand the enforcement authority of the commissioner when carriers submit insufficient information to assess Parity Act compliance. They also specify that a carrier has the burden of persuasion in demonstrating that its design and application of an NQTL complies with the Parity Act, and the amendment reflected here would repeal obsolete provisions and make the bill an emergency bill. So I could go through the reprint and explain all the very specific details of what the amendments do, but that is a summary of, in essence, of what they show.
But I bet we could get a motion.
Yes.
Second.
Well played, Madam Chair.
Okay. All in favor of Senate Bill 684? It's a unanimous vote. Thank you. Favorable with amendments. 10-0. Okay.
I guess the next one listed is 1046. This is a Anne Arundel County Alcoholic Beverages Bill, and this authorizes the County Board of License Commissioners to increase by 35% annual supplementary and other alcoholic beverages fees for certain licenses and permits in Anne Arundel County. The fee for certain license transfers and the renewal application fees for all alcoholic beverages licenses. There's a reprint that shows some amendments. They strike from the bill changes to fees for certain permits and limited purpose licenses. The amendments make technical corrections and then clarify that the holder of a gift basket license may purchase alcoholic beverages from a retail dealer. We've got a letter that indicates support from the local delegation.
Favorable on the second, all in favor of Senate Bill 1046, local bill. Okay,
Don't imagine you're gonna let me put this till the end of the voting calendar, but
please don't.
is this the one that did we talk about the Renaissance Festival in
This
this bill?
is not that one, Bill.
What was that? Wrong one.
No, this is overall, all the
This
fees
is
are
just
being increased.
raising fees on everybody else. Okay.
And they've agreed. Steve Wise has met with the association and they're in agreement.
All on board.
Local bill, all in favor. Come on. Okay, favorable. Favorable.
All right. So Senate Bill 791, you may recall this bill, this is the Health Insurance Utilization Review revisions. This bill has been on the voting list before and was held by the sponsor, Senator Klausmar, while there some additional discussions were ongoing about the cost impact of the bill. And so it's back, and so this is just to refresh. This is the bill that alters and establishes requirements and prohibitions relating to health insurance utilization review and prior authorization, which is the process used by carriers to determine whether a requested healthcare service is medically necessary. It alters requirements related to the internal grievance and adverse decision procedures that carriers use, and establish requirements on payers and healthcare providers relating to the provision of patient benefit information. So there are provisions to increase transparency and communication during the review process. For example, a carrier has to state in detail when denying a healthcare service, the reasoning as to why the service was not medically necessary and why it didn't meet the carrier's criteria and standards. Also alters the criteria and standards that carriers must use in conducting utilization reviews, such as requiring that they be developed by nonprofit medical or clinical specialty societies or organizations that work directly with healthcare providers in the same specialty. There is a provision in the bill is introduced that would require a carrier to allow a patient to remain on a prescription drug when it was previously approved by the carrier, and the prescriber attests that the drug continues to be necessary to effectively treat the patient. That was a provision, this reauthorization provision, that has been the focus of a lot of attention. There's been, debate about, what the cost impact would be with that type of provision. And so the main, so in the reprint in front of you, if you go to page 7 of 32 in the reprint, this is the provision at issue. And what this says is that that a carrier has to allow a individual to stay on a prescription drug if the prescription drug is for the treatment of a mental disorder listed in the most recent edition of the Diagnostic and Statistical Manual of Mental Disorders published by the American Psychiatric Association. So this provision is in place, but this protection applies only to drugs to treat a mental disorder. And so it has been narrowed, and the understanding is that that will have a pretty minimal, if no, impact on the cost for the state plan. So that was really sort of kind of the final piece, under discussion with this bill. There are some other clarifying amendments that reflect some feedback from the Insurance Administration and the Attorney General's office. So like on page 12 of the reprint, these are provisions that deal with the internal grievance process. Amendments here clarify the process for an expedited review of an adverse decision when there's an emergency case. If you go to page 19 of 32 of the reprint, there's some alterations to a reporting requirement on carriers relating to grievance and adverse decisions by carriers. So it keeps in place the quarterly reporting, that is currently in statute, and then alters some of the substance of those reports. And then I think on page 23 of the reprint, there's a change to some of the criteria that a private review agent must use when conducting utilization review. It has to be, the standards have to be reflected in published peer-reviewed scientific studies and medical literature. And then I think, there's some just other clarifying things that are in the bill. And the last maybe thing that I'll flag is on the very last page of the reprint. And there's a reporting, there's a requirement here that the Healthcare Commission establish a work group along with the Insurance Administration. That's changed a bit. So instead of establishing a work group, the MHCC in consultation with MIA must monitor and report on progress towards implementation of electronic prior authorization and access to real-time out-of-patient cost information. So that is changed. And so those are the amendments that I have here in the reprint.
Favorable. Who's second? Senator Lamb, second. I just want to say our vice chair worked really hard on this bill, and it's not as expansive as we'd like for it to be, but it's a start, and particularly for people on mental health medications who really can't handle the starting and stopping and changing. So it's a start, Madam Vice Chair, and thank you for the bill. We had a motion and a second. Are there any other questions about the bill? Can we take a vote on Senate Bill 791? All in favor? It's a unanimous vote. Thank you. Are you asking a question, Senator Lamb?
Wanted to explain my vote briefly. I agree with your point that unfortunately, I think the bill came in much stronger earlier, and that's where I would prefer to have had the posture. And I know that the sponsor and MedChi had worked really hard with others to try to come up with a version. This one is a little bit more watered down than I would prefer. And I think there's still a lot of work that still needs to be done to address mental health step therapy.
I agree.
You, Senator. And we worked very hard, and if you remember the very day that we had the bill hearing, we had everyone up there. We had both sides, and it was a beautiful thing. But
sometimes you get something when you can't get everything, and that's what we did.
and so this way, look at the data and everything for it, maybe we can get the rest of it next year.
There's two chambers.
Nathan, start with Senate Bill 13, please.
Yes. So next, as amended and shown in the reprint, Senate Bill 13 limits the authorized uses of the Maryland Pediatric Cancer Fund to providing grants to eligible applicants to conduct pediatric cancer research only. Authorization for funds to be used to provide grants for pediatric cancer prevention and treatment are repealed. The amendment establishes a pediatric cancer research commission to oversee the award of competitive grants from the fund. These amendments align with what has been applied to the House bill.
What's the amount? Is it $1 million, now $1 million?
There is no mandated funding in the bill. If any decision was made in the budget, you have not been made aware of the specific dollar amount.
Thank you. Any questions? Do I have a motion on move favorable and that was Senator Classmeyer? Who's the second? Senator Ellis. We have a motion and a second. All in favor of Senate Bill 13? Is it unanimous vote? Looks unanimous. Thank you.
Next bill is Senate Bill 714 that specifies that the governor must appoint the audiologist members of the State Board of Examiners for audiologists, speech and language pathologists, and music therapists with the advice of the Secretary of Health from a list that is submitted by the Maryland Academy of Audiology rather than the board. And there are no amendments and there's no fiscal impact.
Move favorable.
Wait a minute. Okay. I just want to ask, is it in the same posture as the one from Health and Government, HDO?
I don't believe that that bill has,
They just heard it.
yeah,
Oh,
it
they
was just heard.
Okay, thank you. Senator Kramer, all in favor of Senate Bill 714?
Yeah.
Unanimous vote. Thank you.
The next bill is Senate Bill 765, which establishes the Business Diversity Incubator Program and Fund in the Department of Commerce for the purpose of providing grants to qualified incubators to establish diverse and effective incubators in the state. Subject to a competitive application process, a required allocation, preferences, and limitations on the use of funds for operating expenses, a qualified incubator may receive a grant from $100,000 to $400,000. The bill does not mandate a level of funding for the program, but does specify that the governor may include in the annual budget an appropriation of $5 million from fiscal 26 through 31. The bill terminates after 7 years. There are no amendments, and this bill is substantially similar to Senate Bill 125 of 2023, which passed the Senate unanimously.
I have a motion.
Move favorable.
Does somebody second Senator Ellis? All in favor of Senate Bill 765? Everyone? Unanimous vote. Thank you.
The next bill is Senate Bill 804, and as amended and shown in the reprint, Senate Bill 804 requires the Stadium Authority to study and make recommendations on the feasibility of establishing and operating a sports tourism facility at Reisterstown Regional Park in Northwest Baltimore County. The amendment extends from July 1, 25 to December 31st of 2025, the deadline for the Stadium Authority to report its findings and conclusions and any recommendations, and alters the effective date accordingly. There was no opposition at the hearing.
Move favorable. Second.
Yeah, thank you, Madam Chair. I just have a question on this. Again, I think I asked the sponsor when he brought it in, but is this typical that we are mandating the Stadium Authority to do certain studies that, you know, this one costs $400,000? But, you know, again, my point was that, you know, everybody in here probably has a good idea that they'd like to see a, you know, something like this in their district as well, too. And the sponsor came back and said, well, I had all these letters of support, which obviously were all communities and groups within that area that was looking at this. So I don't know. I mean, I don't know if this has just been the way that we've done this before or not, but you know, I just think that this is going to perpetuate more and more. And, you know, anytime, you know, something in your district comes up and says, you know, hey, we'd like to see a, you know, a big, you know, soccer fields and lights and all this kind of stuff in our district. Can you put a bill in and ask Stadium Authority to take a look at this? So I'm hesitant in supporting the bill.
Thank you, Senator Washington.
Thank you, Madam Chair. Is this a statewide bill? Or is it a local bill?
It's a local bill.
So the bill only affects Baltimore County, but it's not drafted to,
Not drafted to be a local bill,
Yeah.
because it's using stadium authority money, and that's not local
Correct.
money.
But it is, but
Was my follow-up question, Madam Chair, is, was this approved by the budget committee and making sure that this money was in the budget currently?
Yes, it was.
It was approved by them,
Yes.
$400,000.
Senator Ellis.
Just a question for Senator Hershey's comment. Did I get a letter, email last year from you thanking the senators for your support for that facility in your district? That the, was it,
You did.
yeah,
Yeah.
yeah,
Sent the letter after, we got funding.
yeah, a lot of funding for it, yeah. So we've done these things before. It was like what was that? Was it a youth facility or something like that, or?
But was that a bond?
Yes.
So this is 400,000 for the stadium authority to do the work. We've
Right.
never, to my knowledge, we've never done this.
Well, before these bills, I had a similar bill to this, but it went to budget and tax. It didn't come here. And it passed and for a similar facility. So this one ended up here. I'm surprised it's here because mine was in budget and tax, which passed. And it's usually the studies are done before the funds are expended through the capital to build these facilities in all our districts.
Was yours required by the stadium authority?
Yes,
Okay, and it was approved.
approved. Yes, ma'am.
All right, well, we have a new funding source. We have a motion and a second.
Just to clarify, if I could.
Yes.
Here,
Yes.
the letter that I sent out to all my colleagues was for the YMCA up in Centerville. And I did thank everybody because it did require a bond bill to get approved, which it went through the capital budget process. But obviously, it was something that was very big, and I was, happy that everybody was able to help and support it, but it was a bond bill. So thanks.
Motion and a second. All in favor of Senate Bill 804? Senator Hayes, are you voting?
Sure.
Okay. Senator Reedy, you're not voting.
That has nothing to do with the project's worthiness or the sponsor. I think
I think we need to call the roll.
Senate Bill 804, favorable with amendment. Vice Chair Klausmeier.
yes,
Yes. Senator Kramer.
Yes.
Yes. Senator Hayes.
Yes.
Yes. Senator Reedy.
No, I'm just explaining my vote. It has nothing to do with the project or the sponsor to be honest, this might actually benefit my county a little bit because it'd be right next door, but I think we need to think about
yes, it was.
precedent setting. So
Yes,
Senator Ellis.
Yes, may I explain my vote?
Yes.
Yeah, this project is done, might end up in different committees, different vehicles, but something that we do here in the Senate consistently over time, whether in Hagerstown, whether it's in now Baltimore County, whether in Charles County, I think we can consistently support these projects. So thank you.
Senator Washington.
Explain about this.
Senator Guile.
yes.
Yes. Senator Lamb.
Yes.
Yes. Senator Hershey.
No, in explaining my vote, I certainly would have liked to have seen a letter from the stadium authority acknowledging this and stating that they could do this work.
Was there one?
They're not in the file that I see, so that would have helped me to agree with that, but my vote is no.
Madam Chair.
Yes.
Yes.
Now, Senator
8 to
Hershey,
2.
if he got a letter.
Okay.
That's completely different than us starting to dictate every single one of
I-
them, to dictate projects that the stadium authority has
Yes.
to evaluate.
I don't know
To what end? That they support it or that they?
if they can do it, they support it.
So the fiscal note says the estimate assumes, so MSA estimates the cost of $400,000 to do the study, which is in addition to the operational effect on MSA staff. So they specify that they can do it, but it'll cost $400,000. Yes, yes.
All right, so that's.
Okay.
But they said they could do it for 188, 187 other legislators. I bet there's a few here that they're not gonna do it for, and I think that's kind of the problem too.
Right. Next, we have Senate Bill 816. I have a message. Reading now, I'm gonna read your message.
Okay, next on the list is Senate Bill 816, which alters requirements related to the Cyber Maryland program and fund by number one, requiring TEDCO rather than the Cyber Maryland program to administer the Cyber Maryland fund. Two, clarifying the types of administrative expenses that may be paid from the fund, including hiring staff, consultants, and other necessary professionals. Three, the bill is removing the requirement to hire specific staff for the program, instead just authorizing the expenditures. And four, removing the mandate to provide funding. Removing the mandate to provide funding for specific staff. TEDCO is also required to adopt regulations to award grants under the program. There are some amendments that would require the governor to include $250,000 in the annual budget for talent pipeline management. And so talent pipeline management refers to an approach developed by the U.S. Chamber of Commerce that involves the collection and analysis of real-time industry data to identify cybersecurity workforce needs. There was no opposition at the hearing.
Senator Ellis and Senator Klausmeyer, all in favor of Senate Bill 816. Unanimous vote. Thank you.
All right, so the next bill, Senate Bill 999, I think needs just a little bit of background. And so I'll say that generally a certified nursing assistant or a CNA is a staff member of a patient's healthcare team that performs certain patient-centered tasks like assisting patients with the activities of daily living, serving meals, assisting patients with eating, and providing companionship. So the national landscape for CNAs allows for flexibility to work in hospitals, long-term care facilities, nursing homes, rehabilitation centers, adult daycare centers, and some other settings. In Maryland, however, there isn't this kind of flexibility because of the particulars of the health occupations article. So the role of a nursing assistant or CNA in Maryland is broken down into two designations. And so the first is the CNA, and the second is a geriatric nursing assistant or GNA certification. The certification for the CNA, as currently written in statute, does not meet certain federal requirements. And as a result, the CNAs are only authorized to practice in acute care settings, not long-term care, nursing home, rehabilitation facilities, or some others. The geriatric nursing assistant, in contrast, is defined as a certified nursing assistant who has successfully completed the requirements set forth in federal regulations. And so the GNA designation, as is currently written in statute, meets those federal requirements, and as such, they're authorized to practice in acute and long-term care settings. So with that, Senate Bill 999, as amended and shown in the reprint, alters the designation of and licensure requirements for a certified nursing assistant, creating new designations of CNA 1 and CNA 2.
Senate Bill 999.
We love this bill.
We love this bill. Senator Hayes and Senator Kramer, are you voting? Thank you.
It had a great spot.
It did. Thank you. Okay. Thank you very much, Nathan. Now we're going to David.
Okay, the first bill on the other side of the yellow sheet is Senate Bill 91. It establishes the lease training program in the Maryland Department of Labor and creates the lease training program fund. The purpose of this new program is to train, prepare, and connect job seekers with careers in residential rental housing industry in the state. There are competitive grants totaling $250,000 a year that may be awarded to these designated partnerships, and one grantee may be awarded the entire amount in 1 year. The governor must also include in the annual budget, and the bill is introduced, an appropriation of $250,000 for the program. In fiscal 2026 through 2028, there's a reprint and one amendment offered by the sponsor to the bill. And if you go all the way to page 4, you'll see that the governor will no longer be required to include in the annual budget $250,000, the governor may include in the budget $250,000.
Do I have a motion for Senate Bill 91? All in favor of Senate Bill 91? Senator Ellis? Senator Washington, you okay? Senator Gao, can you vote? Thank you. Unanimous vote.
Okay, the next bill on your list is Senate Bill 117. This is the newborn screening program for Krabby, and Senator Lamb will have to help me say the next word. Okay, the bill has been amended substantially. These amendments are actually from Senator Lamb. And as amended, they require the Maryland Department of Health to screen newborns for new core conditions added by the Federal Human Services recommended uniform screening panel within 1 year and 6 months after the condition is added. The rest of the provisions in the bill are struck. You have a reprint in front of you which shows you all that. The amendments make the bill an emergency bill, alter the process for newborn screening as I just described, and strike specific screening for Krabby, the Krabby thing, and instead leukodystrophy, and instead require the department to implement screening within 1 year of the federal, any screening within 1 year of the federal government's final newborn screening recommendations, and requires a report.
Do we have a motion and a second? Move it to you. Okay, yeah. Senator Kern, you have a question?
Yeah, with regard to the amendment, I'm concerned, with all due respect to the senator who offered the amendment, that at the end of the day, we've got the same problem that exists right now. So in other words, with this very rare but significant disease that, if not discovered very early on in life, requiring very early testing, that these children are not going to be helped. It sounded as if, from what I recall from the bill hearing, that when, you know, the federal, whatever regulators, whatever the entity is that determines this list, the process is typically that the state picks them up anyway. And this bill just codifies what's current with this amendment, what seemed like it was current practice. And I think the goal of the bill sponsor and the people who testified at the hearing is to try to get this onto the list that will be tested as quickly as possible, because it is so important to have this disease discovered very early on. And if it's not discovered, there is nothing they can do to help these children.
I should have mentioned in the uncodified language added in the back, it specifically refers to Krabby leukodystrophy. And they have to do, after federal government issues its final decision, which is upcoming, they have to implement screening within 1 year, not of the federal government's final determination, which is due very shortly.
Well, and at this point, if the federal government is likely at some point to be doing it, can we not implement now with this bill that to get the process going, if there is this sense of inevitability, then let's go ahead and do it and get the process moving instead of delaying it further, waiting on the feds.
Senator Lane.
Sure. So yes, I mean, to Mr. Smolsky's point, it does say that it has to be implemented within a year after the U.S. Department of Health and Human Services moves forward with that recommendation. You know, if we want to shorten it to less than that, you know, you could do 6 months if you wanted to. The sponsor of the bill does agree with these amendments. So just to be clear, he's okay with these amendments, and he would like to see something move forward. And I think he believes that this does is an improvement and does move things forward.
I understand, and I think there was some consideration that in the hope of just getting something done, as opposed to, you know, the concern the bill might have been lost without the adoption of this amendment. But I think it's a conversation we should be having now. And again, if there is a sense of inevitability, why can't we go ahead in this particular circumstance, pass the bill, and then get the process moving so they'll be hopefully testing even sooner. And then if the feds do it and it's a year after the Fed, let's say it's 6 months to a year before the feds decide to do this, then we've got another year out before the state has to implement it. So I'm confused that there would be some harm in passing this bill clean. There's a lot of upside I could see in saving lives. And I don't know why we would delay. That's my point.
So-
No, I'm asking we pass the bill without the amendment so that we ensure we are acting as expeditiously to save these children as possible and not worry about bureaucratic red tape from the feds, and that we do our job to which is in the best interest of these children. That's what I'm saying.
So,
Yeah, thank you, Madam Chair. So, looking at remember the testimony and Health Department came out unfavorable. So with the amendments, Senator Lampkin, did we address those concerns? And are they in agreement now with the amendments? And I know David can
David
answer
can
that.
address that, but if we try to push and go forward, we have to go back to budget and tax because there's a big fiscal note because of the time to develop the test and the equipment. And so we couldn't pass it tonight. If that's what you want to do, D&T has to weigh in. It's over $1 million in the fiscal note. So.
So
And
the
I,
Health Department.
Well, and that's a shame. It
You're-
sounds like it's.
I asked the question, you answered his question and you kind of ignored me. So my
no,
question.
you
my-
asked me,
My
excuse me,
question,
you asked me if the health department's in favor and the answer is no,
okay,
they're in favor with the amendment because of the fiscal note.
so they're not in favor.
They're not in favor of
Okay.
the bill without the
Okay,
amendment.
so thank you for that. So the thing is, they're the experts with this. And I've worked other bills and no one would pass them without the Health Department coming on board. There's the Maryland Department of Health Advisory Council on Hereditary and Congenital Diseases, which they say there's a process for this, made up of all these MDs and a lot of MDs, PhDs on this board. If we are going to, on some legislation, say we have to listen to the Health Department, work with them to get them on board, why are we ignoring the experts now who have to work with, have a process set up to handle these situations? I mean, to me, it's like, let me choose my words carefully. We pick and choose what we do, and we don't remain consistent in what we do. And I have a problem with that. I have a serious problem with that. If we don't care what the administration does, if we don't care what they say, if we don't care what these professionals say and do, well, let's be consistent with that with everything we pass here. But I think we should remain consistent, working with the Health Department to get them on board before we do these major changes and set this precedence.
But the amendments do what the health department wanted us to do. That's why we put the amendments on.
Well, when I asked earlier, you said no, the Health Department did not.
No, they didn't want the bill the way it was.
Okay.
Remember Dr. K's testimony about the cost of testing and equipment?
Yes.
And they want to do the process that you're referring to.
Yeah.
They want the process to go through the advisory board as it always does. So what this says is, once the federal government says it needs to be tested, it's going to go through the advisory board process. And then we'll begin, having the equipment and the testing here in Maryland.
Okay, so thank you for that. Let me summarize my question. My question was, with Dr. Lamb's amendment. And when the health department saw it, did they change their unfavorable to favorable?
I can't answer
Senator
that.
Lamb.
Dr. Lamb would be able to better answer that question.
Yeah, I
Sure.
spoke with Dr. K, the Deputy Secretary at MDH, and they're comfortable with this amendment.
Did they send in a letter to that effect and put that in
I
there?
don't know
If
if there's
they-
a formal
If they now
letter,
with the amendments, I
but
think we should have that.
I can ask them
I
for a
think we
formal
should
letter.
have that
Sure.
before we blow up the entire process that people
But-
use when I put these bills in. I have to negotiate and work hard and get them to come on board. And there's a bill coming in tomorrow where we did that. We worked tirelessly for months and months and months, and we got everybody on board. And it's clear. I think we should follow that process as we approach this amendment. So I would put a hold on this bill, Madam Chair, ask to request a hold on this bill until we get a letter from the health department agreeing with this amendment that we should go forward with this.
Madam Chair,
Thank you.
Madam Chair. Thank you, Madam Chair. A couple of things. I have had bills killed death by fiscal note. So I don't think that we need to be consistent as to whether this bill died because of fiscal note. Now all bills need to die because of fiscal notes.
Senator Kramer, I'm just gonna stop you if you don't mind. Senator Ellis asked to hold the bill. We all get a hold. So it's on hold. We can do our research and discuss it again tomorrow. I'm honoring Senator Ellis's hold. Senator Lamb?
Yeah, can I just clarify to what Senator Ellis was saying? This actually creates a more uniform process because right now the bill as originally drafted was only about Crab A. And so it would have really carved out one condition and identified it for a unique process in the statute. What the amendment does is actually standardize the process across the board for all conditions that are being recommended by the federal government for screening. And so we won't have exceptions of Crab A this and leukodystrophy that and some other condition that. And so this actually will help codify a standardized process and set up a time frame by which our state committee must meet those requirements that are being recommended by the federal government. And in the uncodified, it says that for Crab A, they have to do it within a year. If we want to lower that to 6 months, sure. But that's what the amendment does.
Can you get an email from Dr. Kalyana Ram and Dr. K that he supports this?
Sure.
And I think you can probably get that pretty quickly. If you can't, let me know. I have his phone number.
Yeah, I do too.
Thank you.
Thank you.
So it's held till tomorrow. Thank you. Okay, Senate Bill 651.
Okay, Senate Bill 651 was on the list, I believe last week. This is the bill that deals with the signage at service stations. It requires a sign at, to refresh your memory, it requires a sign at all retail service stations to display the credit and debit price if higher than the cash price, or all three for a gallon of regular gasoline and diesel fuel. A mostly antiquated exemption from existing signage requirements for retail service station dealers who operate with fewer dispensing units is repealed. There are amendments offered by the sponsor. It alters the title and changes it to, instead of gas price gouging, Gas Price Clarity Act. Preempts local governments from passing similar requirements and requires uniform numeral sizes. You have a reprint in front of you with all these amendments listed. It's a 2-page bill. It's not that long, or well, longer than that. It's longer than that.
Do we have a motion on Senate Bill 6? Move unfavorable.
Okay.
Why, can I ask?
I don't think that we should pass bills that don't solve problems just because the sponsor is persistent and keep pushing the bill in.
Okay,
This bill, in my opinion, does not solve the issue, and it remains confusing. The testimony was still, people will not be sure what goes up there on the sign. And I'm, I think that we should really look at this and not go on these bills, just, I'm choosing my words carefully, not just pass them because they keep coming at us with them.
Senator, we do have four counties that have already done this: Montgomery, Prince George's, Howard, and Baltimore City. And the bill does list the highest price, so people know that's the most that they're gonna pay. Where before, the lowest price was listed if you had a car wash, if you paid cash. Now you know what is the highest price you're gonna pay, and if there's other discounts, you know, they can have other signs below it, but they have to list the highest price.
Yeah.
And that's what's happening in other gas stations. And this is just making it mandatory statewide.
So all those counties, Madam Chair, have the same legislation? Because I asked that question, I still haven't received the answer from the sponsor.
I did receive the answer. That's what I'm reading from.
Okay, so I mean, the thing is, you know, I have a problem with respect around this place. I asked the question, I asked the senator to send me, I didn't receive the send to you and not me. And so I have to vote on this legislation, which no one responded back to me. You know, it's just downright disrespectful.
Well, I think
And
in
the
most
thing-
cases, they do respond to the chair. So I'm happy to give you
So,
a copy of this.
Yeah.
If you want to hold the bill, I'll give you the copy, but it's not unusual to respond to the chair.
well,
And I gave it to the analyst.
I understand, Madam Chair.
So I think you're being disrespectful, Senator Ralph. Senator Val?
Chair, and I understand there's some concerns about this bill, but I mean, I think that what the sponsor came to the table with was an agreement that was worked out with the gas stations. And my understanding and recollection is the gas stations were worried that there was going to be a patchwork of different counties. There was pending legislation in different counties, and they would much prefer a statewide solution and just saying this is all they have to do. So they have one thing to comply with. And so I think that, you know, that they came to the table agreeing and wanting this too, for what it's worth. So, that's all I have to say about that. Thank you very much.
Senator Washington.
Thank you, Madam Vice Chair, and I do have a question. Will this bill change the law that already exists in Prince George's and Montgomery County as other four counties, or would it be consistent with those other counties?
It would preempt them, and I don't know
We're getting copies.
Yeah.
I'm getting you copies.
this
Okay.
Prince George's County, they say a sign posted by a gas station must include clearly and visibly the highest credit price. We're given a year to comply with the new requirement. Businesses could be fined from anywhere. So what they're doing in Prince George's is saying that they must include clearly and visibly the highest credit price. This bill is a little bit different. It would just say they have to include it's a little more specific. It would say the credit and debit price if the higher than the cash price, or all three. And in the same sign.
Same thing, it's saying the highest
Yeah.
price.
Is it saying the same thing or isn't?
I don't know. I haven't seen the actual Prince George's law. This is what the summary that was provided by the senator.
Yeah, I just know that our county worked really hard on it. A lot of the progressives in that county worked really hard to try to get that done for them. And I wanted to see if there's a letter of support from the council when they passed it, or just because I don't want to preempt or change what they already have.
Senator Washington, would you like us to hold it so you can go back to your county and ask
Sure,
if they
yeah, it'd be
support
great. Yes.
this
Thank you,
highest
Madam Chair.
price? Senator Hershey?
Yeah, thank you, Madam Chair, and I appreciate the whole too, because I think that's one of the concerns. Even if you are supportive of this, is by going back and preempting, which is what the sponsors want to do now, does it go back to the gas stations that have already made changes based on the previous local laws that have been put in place?
Mhm.
Does this, because of the preemption, force them to do something different, or maybe these counties haven't moved quick enough to fully implement them or not? But I think it's just,
Typically, when we pass a state law, you can do more than the state law, but not less.
right.
So you can be more restrictive, but not less restrictive. So this is, the highest price. I don't know, have you seen those signs where it says $3.19 and then you pull in, and if you don't get a car wash for $11,
Yeah.
then you're paying $3.39.
But
that's
I
what she-
also decide if I don't like the way the signs are, I don't go back again. So
That's
it's,
true.
you know,
That's true.
it's-
Um,
Again, we're,
I just want to say that the gas station, Kirk, he was talking about the weights and the measures, how the ag has to go out and check all them all the time. And he said that would help them for consistency as well. So, and Ellen the other day said, please pass the bill.
Well, it's sold. It's,
Yes.
I just want to correct for the record, we have Nina Demlis, the Director of Government Relations for Baltimore City Mayor's Office, and even a letter that's for us today. Baltimore City has not passed this. There's a bill that's pending in the council, but they have not enacted any such legislation.
Okay, it does say. They have a bill and it's clearly and visibly the highest credit price. So they haven't passed the bill yet. If we pass the bill, then
Yeah, no, I think
Yeah.
clear that 4 jurisdictions had already enacted different ordinances. In this case, they're considering it. There's a bill, but it has not been passed as of yet.
the 4 counties that have passed, you'll see from the memo that we're passing out, all say, include the credit price is one, but that's Montgomery County, but Prince George's, Howard, and the one pending in Baltimore City always say clearly and visibly the highest credit price. Now, there's different fines. Do we have any fines in this bill? Because there's different fines in different counties.
there's, there's no fine specifically mentioned in this bill, but there may be fines elsewhere in the code for violations of any provisions under Title 10.
All right, well, we're holding the bill.
Okay.
You all have the memo now. Senator Reedy, did you want anything else? Did you have another question?
I know we've held the bill, and I don't want to do the JPR thing where we debate a bill for 20 minutes after we've held it.
We're
but-
not. We're going to debate it for 20 minutes.
Yeah. No, I'm really torn about this because I've had people that are in this industry from my county contacting me wanting to be sure they're protected. And they don't want a patchwork, but there wouldn't have been a patchwork if the advocates that want this bill hadn't gone and lobbied these counties. It's literally trying to solve a problem that basically doesn't exist. If you go to a gas station, you end up paying more because you didn't realize it was the cash price. You're like, this gas station sucks. I'm not going back. Problem solved. And most places make it pretty clear that you got a cash price and a credit price. So that's just my little mini rant. So I haven't decided I'm going to vote on it yet because I want to help my constituents, but I'm mad that they've been.
Well,
put
you
in this
got
position.
24 hours to
Thank you. I
decide.
just had to say it. It had to be said.
All right. If we have no other questions, we've held the bill. Senate Bill 796, Senator Simon Ayers.
Okay, Senate Bill 796 establishes the Maryland Disability Service Animal Program and Fund in the Department of Disabilities for the purpose of referring eligible individuals to a selected nonprofit training entities to be paired with an appropriate service animal. There's 2 amendments. They're technical and alter the definition of eligible individual and alter the provisions for disqualification from the program.
Who was the second? Thank you. All in favor of these lovely dogs? Senator Washington, are we, okay, unanimous vote. Thank you.
Okay, the next bill on your list is Senate Bill 938. It requires the Maryland Department of Health to develop and implement a 3-year public education campaign on prostate, lung, and breast cancer prevention that targets communities disproportionately impacted by those cancers. The details of the campaign include providing educational information, promoting participation in screenings, and providing information on legislation that reduces cost barriers. For fiscal 2026 through 2029, the governor must include in the annual budget bill an appropriation from the Cigarette Restitution Fund for the public education campaign. The bill terminates in September 30th, 2029. The amendment specifies, and you have a reprint in front of you, that the program will only promote screenings, gives the department more time to implement the program, and adds an additional reporting requirement and reduces the allocation from the CRF to $750,000.
Second. Classmeyer, all in favor of,
Senator Ellis has a question.
I'm sorry, Senator Ellis, go ahead.
Yes, thank you. And so during the hearing, there was an issue with where the money will come from. And someone from a cancer organization said, no, it shouldn't come from the Cigarette Restitution Fund. And you mentioned, Madam Chair, I believe, correct me if I'm wrong, that, I'm sorry?
Go ahead.
That in the House, they create a different funding source for that. So is that cleared up as far as the funding source for this? Bill?
The money reduces the amount from the cigarette restitution fund to $750,000 from, I believe, from $2 million to $750,000. So that was designed to get at some of the concerns of the more diversion of CRF funds. The House is moving the bill as similarly amended.
Okay, so a small amount coming from the,
A much smaller
Smoking
amount
restitution.
from the cigarette restitution
Okay.
fund will be diverted.
Thank you for that.
David, do we know if the 75 cents a pack is passing, that has it passed the House yet?
That would be the cigarette restitution fund doesn't get any money from the cigarette tax.
Doesn't get it, okay.
Ironically, yes.
Okay. Senator Ellis, are you comfortable with that answer?
Yes, ma'am. Thank you.
Thank
Senator
you.
Washington.
Senator Washington.
Thank you, Madam Chair. This is a really important bill. I really do appreciate the bill sponsor. Why do we decrease the amount?
I think it was probably to, I'm theorizing here, but it's probably to make the folks who were concerned about more money out of the cigarette restitution from other programs feel a little bit better.
And it pushes it back a year before they can implement it? Is that
It
what
gives
you're
the department another year to get ready to implement the program.
saying? And the-
I will say this is a Black Caucus priority.
I'm not, I know that, Madam Chair. I'm asking,
One knew
I'm asking
that.
questions I'm asking questions so I can sell this back at home, because it's a good bill. And so the last question was about just it was language in the bill that says they will target certain communities. Does that still exist? in the bill?
Nothing else has changed regarding the purpose of the program.
Thank you.
Do we have any other questions on Senate Bill 938? All in favor? I have a unanimous vote. Thank you.
Okay, this is gonna be fun. The next bill is Senate Bill 975. It establishes the Reproductive Health Care Clinic Security Grant Program in the Governor's Office of Crime Prevention and Policy. The program will provide grants to assist reproductive health care clinics in the state with the costs associated with security improvements. Improvements may include perimeter lighting, fencing, door locks, cameras, and alarms. For fiscal 2026, the bill is introduced may include $500,000 in the budget for the program for fiscal 2026. There are some amendments in front of you in a reprint. The first is technical, and amendment number 2 clarifies that a reproductive health clinic is a clinic that provides legally protected health care in the state. And I just received not too long ago an additional amendment from the sponsor, which would move the program from the Governor's Office of Crime Prevention and Policy to the Department of Health. I don't know if you want that reprint, but that's what the amendment does. No, it's an additional. I just got this not about 2 hours ago. I wasn't able to get into the packet.
We have a motion favorable. Can we have a second? We don't have a second?
Second.
Senator Guile. Now we can discuss. Senator Hershey, you have questions?
Questions.
Mhm.
Unfortunately, this is just one of those feel-good bills that really doesn't do anything. The fact that there's gonna be $500,000 in a fund for grants that will, let's see, costs associated with security improvements, including interior, exterior facility hardening, perimeter lighting, fencing, other barriers, door locks, access control systems, security cameras, alarms, panic buttons, lockdown systems, and public address systems. That would probably be sufficient if there was only one of these facilities in the state for $500,000. But we've passed legislation to drive this type of business here to Maryland. So there's many more than just one of these. So, I'm regardless of why it's here, it's just not something that makes any sense. You're not gonna attract a lot of clinics that will be able to go to this grant fund to make any changes. It's not necessary. I think that these businesses should be able to provide their own security if that's what's needed. So I'm going to vote no on it. Thank you.
Do I have any other, Senator Reedy?
About the amendment first, because I guess you've already adopted it, but or if you've adopted or not, why
No,
are we
haven't
taking?
adopted.
Okay. Thank you. Why are we taking this out of Governor's Office of Crime Control? Because this is literally security, because we were told that there's all these threats. FBI has actually said 70% of the threats in the country have actually been aimed the other direction at right to life activists, but I'm sure there have been some threats to clinics, and people shouldn't threaten or try to threaten to harm people, no matter what. But why are we putting this in health when it's clearly like a security issue?
You'd have to take that to ask the sponsor. These were just received a couple hours ago, so there was no opportunity to.
Okay, second question.
You have another question?
Another question.
Okay.
And perhaps a comment, but another question. So who can apply for this besides abortion clinics? Anybody else?
With the.
If you provide pregnancy services, pregnancy related services, can you apply for this money?
Not with the not with the added yeah, the definition makes clear who can apply for these funds. The added definition of healthcare provider.
So if you're providing services for expectant mothers to try to help them in a time of need, you're not able to apply for this, but you might be a target because you have the wrong philosophy on abortion. You can't apply for this, correct? You don't think so? Because
You have to.
You have to be categorized that way.
Legally protected health. They have to be providing legally protected healthcare, which is defined in the Health General article.
Okay. Thank you.
How is that defined? How's legally protected healthcare defined?
Means all reproductive health services and medication supplies related to the provision of abortion care and other sensitive health services as determined by the Secretary based on the recommendations of the Protected Healthcare
It's pretty
Commission.
clear. Senator Hayes?
Yeah, Madam Chair, I guess I'm struggling with this bill as well. I know that I disagree with some of my colleagues in that there are legitimate concerns as it relates to these facilities. But earlier this session, we passed Senate Bill 430, the Community Health and Safety Works Grant Program, which provides $10 million for institutions that want to deploy different, safety measures for those institutions. I think these types of institutions that are outlined in this bill specifically are addressed in the $10 million grant that we established. The $10 million grant is nothing new. We just codified it. Maryland Department of Housing and Community Development has had this community safety work grant for at least the last 3 years. I think the senator just took on the responsibility of making it in law, but this isn't something new. It's available that these organizations can already apply for. So if we want to verify that, I could, get in contact with the department and have it, by tomorrow, but I think it's already addressed in something that we've already passed and moved over to the House.
Okay, let's hold the bill and wait for you to verify that.
Yes, ma'am.
So you're asking to hold the bill. Thank you.
Oh boy, am I going to be busy tomorrow. Okay. Next bill is Senate Bill 1006. This is also amended. You have a reprint in front of you. It's an emergency bill that authorizes a hospital to sell debt owed by a patient to a governmental unit or entity that is under contract with the unit for the purpose of canceling the debt of the patient. The contract between the hospital and the governmental unit or contract purchasing the debt must include a written agreement from the patient allowing their debt to be sold. The patient is not responsible to the hospital, the unit, or the contractor for any amount of the debt that is sold, and any interest, fees, or costs associated with the debt or sale, or any other of those other costs. This bill will terminate in December 31st, 2026. It's basically a 2-year bill that would authorize groups who wish to purchase debt of patients. You've passed several bills over the past couple of years dealing with hospital debt, including reimbursement from hospitals. That's still being worked on. You have some amendments in front of you. Amendment 1 is technical. Amendment 2 is clarifying. Increases the income limit to increase the number of eligible patients to 500% from 400%. And and make some clarifying changes to the language regarding the Health Services Cost Review Commission and their determination of rates. So that's the bill that's in front of you. It's a limited duration and allows certain entities to purchase patients' debts who are in arrears to their hospital.
Second.
All in favor of Senate Bill 1006? Okay,
Just, do these amendments address the concerns from MHA? MHA provided just a letter of information that, discussed a couple of what they called significant operational hurdles. These amendments address that.
Yeah, I believe the folks from Baltimore City worked.
That's how they came about, because
I
that's
trust
why
my
the amendments
colleague.
were introduced,
You
yes.
say yes.
so the amendments came because of your conversation. Well, thank you. Okay, now can we take a vote on Senate Bill 1006? All in favor? Do I have a unanimous vote? Senator Kramer, thank you. And it's an emergency bill.
It's an emergency bill. Okay. The final bill on your list today, well, there's a withdrawn bill, but the final bill on your list today is Senate Bill 1103. You have a reprint in front of you. The bill as amended makes changes to the required notice regarding the charging of facility fees. If you recall, several years ago, you passed a law to provide notification to patients who may be charged facility fees from using hospital services and regulated space at a hospital. The bill also requires the Health Services Cost Review Commission to study and make recommendations regarding hospital outpatient facilities fees and submit a preliminary report by December 1st, 2024, and a final report by December 1st, 2025. The two amendments, there are three amendments to the bill. One is technical. Amendment 2 strikes a new definition and an altered definition in the bill in lieu of the report's findings and the upcoming report's findings and recommendations, and exempts the commission from the state procurement requirements only for the purpose of hiring a consultant to assist with the study, and sunsets the exemption for the commission and the study requirements in 2 years.
Who's favorable?
Have a second? Wait a minute. Can I have a second? Senator Hayes. Thank you, Senator Reedy.
So does this, there was favorable with amendments from MHA. Again, is this part of what they were interested in? I'm just trying to figure out.
They were concerned about the change in definition. This puts
And it
all the
strikes that.
definitions back into this posture they were in under existing law.
And there's one other note I had. I'm sorry. It's been a long day. Okay, never mind. We're good. Yep.
Yeah, they want, HSC wanted the procurement, so that's in there also.
Okay, all in favor of Senate Bill 1103? Unanimous vote. Thank you.
And there's a withdrawal, Senate Bill 1061.
All in favor of the unfavorable?
Oh.
Okay, unanimous.
And I believe there's, Patrick has a housekeeping thing he wants to bring up to the committee's attention.
Yes, so regretfully, I have to bring a housekeeping matter before the committee relating to Senate Bill 539, the ticket bill that was discussed yesterday. So,
All right, but you all need to hear this. This is a bill that we've all worked on and we need to hear the amendment. Thank you.
Just before you, this is a reprint that reflects the amendments that are reflected in the committee amendments. You may recall that Senator Klausmeyer had an amendment that was this section, this bill. Okay, and so the amendment that was also in Senator Klausmeyer's set of amendments would have struck that provision. And as I would understand it, the main rationale for that amendment is because other amendments have struck a provision that sets a cap on the fee, you know, that the secondary ticket marketplaces can charge. But but I think it's a policy question. And so I guess the question before the committee is, was the intention of the committee to include that amendment, striking that provision such that a floor amendment should be offered to reflect the committee's will? So I'll stop and then.
Can I just jump in real quickly here? Okay, so, but I do think, so I think that part of that language was in there just because of as Patrick put, because of the cap on the secondary market. That said, I do think that that language in there is important from the perspective of that a reseller. So these like StubHub, for example, can't have a website that would sell a speculative ticket. So instead of where it says resale, I would strike that resale and just make it sale. Because we're banning speculative tickets, and it just says then, so it would, the intent would be originally was like they couldn't resale tickets that would be in violation because that was part of the cap, but now it would say that.
You're amending the amendment. Is that what you're saying?
Well, I don't know what I'm doing. If that's what it is procedurally, then yes, Madam Chair.
Can you reread what?
Yeah, so what Senator Gile is proposing for that provision is that it would say a secondary ticket exchange may not provide a marketplace for the sale of a ticket that violates this section.
Sale of a resale ticket.
For this-
Sale ticket, it would be sale of a speculative ticket, which is no ticket at all, does not exist at all. It's
fired up there. You were just.
Oh, I know, I know.
Time of year, we all get fired up.
Let me just, I actually
right.
think I need to, so are you wanting it to read for the sale of a speculative ticket or
For the sale of a ticket that
violates this section?
that violates this section, because that would be applicable and say you
Is
can,
the entire bill.
yes.
So we still have it on the floor.
The section refers to the entire bill, so everything that's reflected in the bill here is captured within this reference to section.
You went up that mountain? What, are you going up the mountain? No, this is.
But I think it's important. I think that that language is important. And I do think that it falls within the intent of what we wanted to do. We wanted to ban speculative tickets and saying that you can't have a marketplace to sell speculative tickets. So we're saying not only are these speculative tickets banned, but also you can't have a marketplace to sell speculative tickets.
And I agree with you, but I think that's what Patrick was just saying, that you want this section, you want it to be a secondary exchange. Where did you say, Patrick?
So what I hear is is it to read a secondary exchange may not provide a marketplace for the sale of a ticket that violates this section.
Speculative ticket. Is that what you're talking about? Or
Section is the speculative ticket.
yeah, but that's not what he said.
Patrick, what is it? What do we need to make sure that it just says that they can't sell a ticket that violates that section?
That you would just change the word resale to sale.
That's what I'm suggesting. Yep. Yeah, agreed. That's what he said. Yeah, Senator Hershey, I don't know that if you're understanding Patrick differently.
I heard him also say, should it just have said speculative ticket? But now,
But I think he's saying because that's entire section, so that's applicable to that entire section previously, where we've already said immediately prior to that.
Yeah, I mean, I think it refers to everything that's reflected in the bill,
Yeah.
Substantively. So, just to add another, feature to this, there is a provision that the committee added relating to refunds. And that provision says that a ticket issuer, secondary ticket exchange, or reseller shall provide a purchaser with a full refund of the total amount, when certain things happen.
Right.
So you can't provide, so under this provision, because this applies to the entire bill, a secondary ticket exchange can't provide a marketplace, that doesn't have a policy that reflects what needs to happen when a refund is due. So when you have that provision, a secondary marketplace can't do anything that's listed in the bill here, that would violate the bill. It's not just to the speculative tickets, but there are other things too.
Move the amendment.
Does sale I'm for whatever gets us out of here in the next few minutes, but does sale accomplish that? Just changing it to sale, does it accomplish what you just said? Or a secondary ticket exchange may not provide a marketplace for the sale if we amend it.
In violation of it.
Well, the secondary market is already a resale, right? You don't want
Yeah.
to use the word resale.
Right.
Well, they're not reselling a speculative ticket though. They're selling it.
But Patrick, I guess I thought, Patrick, that where that statement is referring to anything above that.
Yeah.
Because it's D. So above that is where we talk about speculative tickets. You could just say the sale of a ticket in this section.
Well, the section includes subsection A, subsection B,
Okay,
subsection C, subsection D, subsection E. So it would include the ban on speculative tickets. It would include this refund provision. That's all within the section.
Okay. But-
why is it there though? Why isn't it at the very bottom of everything?
It's just the way that the amendments were.
Oh, okay, all
prepared.
right. I'm just trying to understand. Okay.
But you're saying. You're saying essentially that this section is the entire bill, right?
Yeah.
Okay.
Yeah.
So this isn't just a conversation about, well, that's the concern. Is what you wanted to say violates that it encompasses the entire bill or just speculative tickets?
I'm fine with it covering it all because ultimately we wouldn't want a secondary market or any market for that matter to violate what's there, to provide a marketplace that's in violation of everything that we're trying to do by this bill.
So if you really want it to be all encompassing, so that there's precision with the reference to the speculative tickets, it could read a secondary ticket exchange may not provide a marketplace for the sale or resale of a ticket that violates this section.
Sure, that's fine with me too.
With me.
Madam Vice Chair?
The problem is StubHub has to rely on the listing person to comply. What does that mean?
The listing person is the person that's actually owns the ticket that is now
Okay.
got it up for sale.
Oh, I see. Yeah. Well.
So Senator Reedy, you have a question?
Oh, I'm sorry. I was just saying it was fine with me, but I do understand that's a problem.
So one more time, what is the amendment going to say, since it's not in writing?
Yeah, so it would be a secondary ticket exchange may not provide a marketplace for the sale or resale of a ticket that violates this section.
I like it.
Perfect. I love it. Move favorable.
Thank you. We got a favorable and a second. Senator Washington, Senator Ellis, all in favor of the amendment that's going to be on the floor. Thank you, Senator Hayes. Senator Lamb, unanimous. Senator Hershey, yes, no? All right, roll call, madam. Roll call.
Senate Bill 539 on the amendment. Vice Chair Klausmeyer.
Yeah.
Yes. Senator Kramer.
Yes.
Yes. Senator Hayes.
Yes.
Yes. Senator Reedy.
I'll say yes.
Yes. Senator Ellis.
Yes.
Yes. Senator Washington.
Yes.
Yes. Senator Guile.
Yes.
Yes. Senator Lamb.
Yes.
Yes. Senator Hershey.
No.
No. Madam Chair.
Yes,
Yes.
9-1. I just want to remind the committee, you all have amendments now, amended bills that we held today. Those are not to be shared. You can do your research, you can call departments, you can ask, but you don't pass these amendments out to anyone else. No. Not the ones that we're still holding. Yeah, the ones we're holding. Yep, okay? Just a reminder, that's always been the policy. Thank you very much. Have a good evening. See you all tomorrow.